Let's talk about fat transfer to the nose. That's actually a fantastic question and does come up from time to time. Hi, I'm Dr. Sean Delaney, a facial plastic surgeon in Houston, and I perform a lot of fat transfers. So in general, fat transfer to the nose, like fat transfer to the lips, is not particularly effective for adding volume. And the reason for this is the transferred fat is a free graft and it needs to have maximal contact to surrounding tissue in order to have the best chance of surviving. Now, in the nose, the subcutaneous fat is a very thin layer right under the skin, and there's not a lot of space for us to inject the fat. So you could get a little bit of the fat surviving, but you're not really going to be able to add any meaningful amount of fat because there's not a thick tissue plane where you could spread out and inject the fat in multiple layers. As opposed to the cheek or the temples, where there's some more depth to those areas and you can spread the fat out, then you can add more volume. So in the nose, you could add a ton of fat in, but the reality is most of it is probably not going to survive because there's just not enough tissue to spread the fat out evenly to give it that extra contact with blood supply that it's going to need. Now, the one purpose I would inject fat into the nose for is more for the regenerative properties of the stem cells within the fat tissue within the nanofat. In fact, Dean Toriumi out of Chicago has been preaching this for a long time for nasal scarring or revision nasal surgery, where we want a little bit boost of kind of regenerative or healing properties. So in cases where there's scarring, acne scarring from previous surgeries, we may inject a little bit of fat and inject some nanofat. And it's more to kind of help with the scarring, help with the healing, and less for augmentation. So if you're looking for augmentation to make the nose or the bridge taller, I think there's other more tried and true consistent methods than using fat transfer. So great question, thank you.